He died 7 times in 48 hours. Each time he came back, he begged not to be resuscitated. What he saw on the other side changed all of us forever. My name is Carla. I've worked for 12 years as a nurse in the ICU at Regional Hospital. I've seen a lot during this time. Deaths, miracles, goodbyes. But nothing, absolutely nothing, prepared me for the case of Thomas Keller. It was an ordinary Tuesday in March when he was admitted. Car accident on the highway, multiple fractures, liver, laceration, moderate head trauma. Serious, but nothing to indicate what would follow. Thomas was 38 years old, an engineer, married, with no relevant medical history. A patient like so many others. The surgery went well. 3 hours of procedure, bleeding controlled, positive prognosis. He was taken to the ICU for recovery. I was on duty that night. At 2:23 in the morning, the monitors went off. Cardiorespiratory arrest. The team reacted in seconds. Cardiac massage, defibrillator, adrenaline. 2 minutes and 40 seconds later, he came back. Heartbeat restored, breathing stabilized. Standard protocol. I noted in the chart, CPA successfully reversed. Probable cause, delayed hypovolemic shock. But then he opened his eyes. And what I saw in those eyes I'll never forget. It wasn't post-anesthetic confusion. It wasn't disorientation. It was pure terror. He stared at the ceiling as if he saw something there. Something we couldn't see. His lips moved, but no. Sound came out. He was connected to the mechanical ventilator. Couldn't speak. I tried to calm him. Said everything was fine. That the surgery had been successful. That he was safe. He looked me straight in the eyes, and then raised his trembling hand and made a gesture that chilled me. He drew his finger across his throat, in a clear motion. He was asking to die. I thought it was trauma, pain, confusion. I applied sedative according to protocol. He fell asleep, but I saw tears streaming down his face. I noted in the chart, patient presents extreme post-operative agitation, sedation administered. 3 hours later, at 5:40 in the morning, it happened again. Cardiac arrest, second resuscitation. This time it took us 3 minutes and 15 seconds to bring him back. When he woke up, he was even more terrified. He ripped off the sensors, tried to pull out the throat tube. We had to physically restrain him. 4 professionals to hold down a man who had just come out of surgery. Dr. Mendez, the surgeon in charge, was called. He reviewed everything: cardiac exams, oxygenation levels, brain function. Nothing explained the arrests. Technically, Thomas was stable. His heart was working well. There was no medical reason for it. But it happened again, and again, and again. Third death, 11 hours and 47 minutes. 4 minutes and 8 seconds until resuscitation. Fourth death, 17 hours and 22 minutes. 5 minutes and 32 seconds. Fifth death, 23 hours, 15 minutes. 6 minutes and 4 seconds. With each resuscitation, it took longer to bring him back. And each time he woke up, he was more destroyed. Not just physically. There was something in his expression, in his eyes, that was fading. As if with each death, a piece of him stayed on the other side. On the 5th resuscitation, we finally managed to remove the tube. He could speak. The first words were, "Please let me go. You don't understand what you're doing." Dr. Mendez tried to talk, asked what he was, feeling, seeing. Thomas closed his eyes and said, "It's not what I see. It's what they show me." They? Who were they? But Thomas didn't answer anything else. He just repeated, like a mantra, "Don't bring me back. Don't bring me back. Don't bring me back." That's when I noticed something strange. On the tray beside the bed was a clipboard with paper. Thomas had been scribbling something between arrests. I picked up the paper and felt my stomach turn. It was a symbol, or rather, it was the same symbol, drawn dozens of times. A circle with lines that intertwined in a geometric, almost hypnotic way. It didn't seem random. It seemed purposeful, intentional, as if he was trying to reproduce something he saw with the greatest possible precision. I showed it to Dr. Mendez. He frowned. "It could be hallucination induced by cerebral hypoxia," he said, but his voice didn't sound convinced. That night, I was on duty again. Thomas was quiet, staring at the ceiling. I approached and asked about the symbol. He slowly turned his head to me. "You shouldn't have seen that," he whispered. "What is it?" I insisted. "It's the mark of the place." "What place?" He swallowed hard. "The place between, where we go when we die, before deciding." I felt a chill. Deciding what? Whether to come back or stay. "And you want to stay?" His eyes filled with tears. "I don't want to, but they want me to come back. They say it's not my time yet. But every time I come back, they come closer." "Carla?" He grabbed my hand with surprising strength. "Every time you resuscitate me, you're opening a door, and that door shouldn't be opened so many times." I tried to process that. Was it delirium? It had to be. But the conviction in his voice, the genuine fear. "Who are they?" I asked. He opened his mouth to answer, but at that exact moment, the monitors went off again. 6th cardiac arrest. 2:34 in the morning. This time was different. It took us 8 minutes and 47 seconds to bring him back. 8 minutes. Technically, irreversible brain damage occurs after 6, but when he came back, he was lucid, completely lucid, and aged. I know how that sounds, but I swear he seemed to have aged years in hours. His skin was more sagging, hair more gray, eyes more sunken. Dr. Mendez saw it too. We all saw it, but no one commented because it didn't make sense. Thomas looked at us one by one, then said with a terrifying calm, "Now they know about you." "What do you mean?" Dr. Mendez asked. "I came back 6 times. 6 times I crossed the door, and each time they followed a little closer. Now they've seen where I passed through, seen this place, seen you." No one knew what to say. Then Thomas grabbed the clipboard again and drew. But this time it wasn't the symbol. It was a corridor. Our corridor. The ICU. With perfect details. The position of the beds, the windows, even the clock on the wall. And in the drawing, there were figures, silhouettes standing, beside each occupied bed. "They're here now," Thomas whispered, watching, waiting. That's when something happened that I still can't explain. All the patients in the ICU simultaneously began to get agitated. All 7 occupied beds. People who were sedated began to move. Monitors set off alarms, but they weren't real emergencies. It was as if everyone had the same nightmare at the same time. The team ran to attend. I stayed with Thomas. He looked at me with something that seemed like pity. "I'm sorry," he said. "You didn't have to be involved in this." "Involved in what?" "In the 7th death." My blood froze. "Thomas, you're going to be fine. We'll figure out what's causing—" "You won't," he interrupted me. "Because it's not medical. It never was. It's the price. Every time someone crosses the door and comes back, a price is paid. 6 times is too many. On the 7th, his voice failed. On the 7th, something comes along. At 14 hours and 18 minutes the following afternoon, 48 hours after the first arrest, Thomas had his 7th death. This time it wasn't cardiac arrest. He simply stopped, as if a switch had been turned off. One moment he was breathing, the next he wasn't. Without warning, without struggle. We initiated resuscitation protocol. But something was wrong, very wrong. With each chest compression, a strange sound came from him. It wasn't air leaving the lungs. It was almost like whispers, as if several voices were speaking at once inside him. 10 minutes of attempts, nothing. 12 minutes. 15. Dr. Mendez looked at the clock and did what he had to do. Time of death, 14:33. Cease efforts. Thomas Keller was dead. I covered the body according to protocol. The team was silent, shaken. 48 hours of fighting for nothing, or for something we didn't understand. That's when I saw the paper on the tray. Thomas had drawn one last thing before the 7th arrest. I approached. It was the same symbol. But this time. There was a word written in trembling letters underneath. Sorry. My hand trembled when I picked up the paper. That's when I noticed something on the back of the sheet. I turned it over. There was a list of names. 7 names. I recognized them all. They were the 7 patients who were in the ICU that night, the ones who got agitated at the same time. And beside each name, a date. Future dates. The first was 3 days away. I quickly put the paper in my pocket. I didn't show it to anyone. I don't know why. Maybe because I was already questioning my own sanity. In the following days, I tried to return to routine, but the hospital seemed different, colder. The corridors echoed strangely. Shadows seemed to move at the edge of peripheral vision. And then it began. 3 days after Thomas's death, the first patient on the list died. Sudden cardiac arrest. No medical explanation. 5 days later, the second. Fulminant pulmonary embolism. A week later, the third. Hemorrhagic, cerebrovascular accident. All on the exact date Thomas had written. I requested access to the records. I needed to understand. I went to the archive, looked for Thomas's complete history, and I found something no one had noticed before. Thomas had been admitted to that hospital once before. 10 years ago. Cardiac arrest during simple surgical procedure. He was successfully resuscitated. He stayed hospitalized for 2 weeks and was discharged without complications. But in the psychiatric report, from that time, there was a note. Patient reports recurring dreams with watching figures. Follow-up recommended, but patient refused. 10 years. He had already crossed the door before, and something had been following him since then. I continued investigating. I pulled old records, and I found a disturbing pattern. In the last 20 years, the hospital had 12 cases of patients who died and were resuscitated multiple times in a short period. 12 cases, and in all of them, there was a subsequent unexplained increase in mortality among patients and even staff in the following weeks. It wasn't Thomas. It never was. It was the hospital, or something in the hospital, or something the hospital accessed each time we crossed the frontier between life and death with our machines, our defibrillators, our medical arrogance of controlling the uncontrollable. Cardiopulmonary resuscitation, a miracle of modern medicine. But what if sometimes we brought back not just the person, but also something else? 4 of the 7 patients on the list have already died, on the exact dates. The 3 remaining are alive, but terrified with each passing day, knowing the date is approaching. Dr. Mendez requested a transfer to another hospital. He gave no explanations. He just left. The ICU where Thomas spent his last days was renovated. They say it's equipment upgrades. But the old staff know the truth. No one wants to work there. Patients complain of nightmares. Nurses report sensations of being watched. And the room where Thomas died? It was deactivated. Officially, due to structural problems. Unofficially, well, 3 different patients who stayed there after Thomas's death had the same reaction. They woke up screaming, saying there was someone standing in the corner. Always the same corner. And they always described the same thing. a silhouette that had no face but seemed to be waiting. I still have the paper, the symbol, the list, stored at home inside a drawer I rarely open. Sometimes, late at night, I take it to look. I try to find meaning, a rational explanation. But what haunts me most isn't the symbol. It's not the deaths. It's a single question Thomas asked during his 5th resuscitation. A question I didn't pay attention to at the time, but that now echoes in my mind every night. Carla, when you sleep, do you dream you're awake? Or when you're awake, do you dream you're sleeping? I didn't answer. He continued, because after the 2nd death, I couldn't be sure anymore. And now I'm afraid that all of us are already on the other side. And that this hospital, these people, you, are just the dream of someone who died and doesn't know it yet. Thomas Keller died 7 times in 48 hours. Or did he die only once, and the other 6 were just echoes? Ripples in a reality that tried to correct itself 6 times before finally accepting the inevitable? Medicine teaches us to fight death. Cardiopulmonary resuscitation saves thousands of lives every year. It's science. It's protocol. It's our duty. But Thomas made me question, should we always? Should every life be brought back? Or is there a point where the frontier between life and death should not be crossed again? I don't have an answer. What I have are sleepless nights. What I have is the constant sensation of being watched. What I have is the fear that somewhere in the hospital where I've worked for 12 years, in some corridor I walk daily, there are things waiting for someone to cross the door too many times, waiting for the opportunity to cross back. 3 patients on the list are still alive. Their dates are approaching, and there's nothing I can do. I warned doctors, psychiatrists, administration. Everyone thinks it's stress, trauma, coincidence. Maybe it is. Or maybe Thomas was right. And something came along in the 7th death. Something that now walks the corridors of this hospital. Something that sees through the eyes of patients in comas. Something that waits patiently each time a heart stops and restarts. This is the story of Thomas Keller. The man who died 7 times and tried to warn us about the price of defying death repeatedly. Maybe you think it's fiction. Maybe you think it's the delirium of a nurse too tired from night shifts. I'd like to believe that too. But if you've ever gone through cardiac arrest and been resuscitated, if you know someone who came back, pay attention to the dreams, to the shadows, to the corner of the room when you wake up at dawn. Because maybe, just maybe, they came along. Tell me in the comments, do you believe there's a limit to how many times we can cross the frontier between life and death? Have you ever had an inexplicable experience in hospitals? Have you ever felt something was watching? If this story made you question the nature of life, death, and what exists between them, subscribe to the channel. Every week, I bring real cases that medicine can't explain. Cases that are on the edge between science and the inexplicable. And share with someone who needs to know that not everything can be brought back without consequences. Until the next case.